But actually, while speaking about overcoming the obstacles to laparoscopic hernia surgery in a country like Bangladesh, and we have done some surveys among our surgeons in this country and found out some obstacles. And we thought it is better to share with our friends how we can help get help from our friends and help each other to overcome these problems. You know, lab was started uh, well back in 87, 85, but in Bangladesh we were not very far uh, away from the starting point. We started in 1991. And if you talk about, or if I speak about the present situation of minimal access surgery in this country, more than 1,000 general surgeons are working in this field. And though Dhaka is the center of the country, but there are people and surgeons who are going outside Dhaka on the weekends and holidays to popularize this surgery and to do this surgery. And surgical teams are doing in a way in the whole country. And again, there are some good setups and good team in other districts too. So as a whole, the patient demands it was a very important issue to popularize this minimal access surgery throughout the whole country. And as I talk about the hernia, uh, evolution of hernia surgery, back in 1993, the laparoscopic hernia surgery was started in different part of the world, and also India was one of the pioneers in this field. And in Bangladesh, the first step was done in 1999. This shows that we were little lagging behind, and IPOM Plus was started around 2000, TEP around 2003, and now MIS, ACS, and TAR. ACS TAR is yet to be tried laparoscopically, but some surgeons are working on open procedure. We did a survey 3 years ago, and we really wanted to see whether our surgeons are how they think about this hernia surgery, and how they what are their what they are doing at the moment. So 3 years ago, about 154 surgeons performing surgeons participating in the study, and we found that more than 70% or 75% surgeons was still preferring the open inguinal hernia rather than laparoscopic surgery. In case of ventral hernia, also about 80% were doing open even 3-4 years ago. Actually, I'll tell you later, we have started this Hernia Society of Bangladesh in 2017, and we actually asked or had the opinion what are the barriers for minimal access surgery for hernia. And we found that most of the people, surgeons, were talking about, they were confused about the advantage and didn't get the opportunity to learn, and they thought it takes long time to learn, and there are more dangers in this surgery. And of course, the cost was a very important factor. And again, what we saw, uh, uh, who are not practicing MIS surgery, they really wanted to take part in the workshop and also wish to work with the experts to learn it. So it was a positive note from them that they want to learn. And 2 years ago, again, we were asking about 45 surgeons by a survey, and we had some questions to them who were doing laparoscopic surgery for the last 5 to 20 years. And of course, they have been doing surgery in the central capital city in Dhaka, as well as in the district level hospitals. Those are really low resource centers. We really think about the low resource centers where this should be popularized and how we can make it popularized. And actually, we asked them many questions, I mean about 10, but the primary things were how many labs they have done, what is the preferred technique, and the cost involvement. We have seen about 53%, more than half were from with an experience of 10 to 15 years. And you can see most of the surgeons they had, well, less than 50 surgery as a whole in their experience uh, uh, of doing laparoscopic procedure, both in uh, around just around 50% in ventral and less than 50% in inguinal. That seems there is still are not really doing laparoscopic procedure confidently. And the preferred technique was, as usual, this should be same as all over India. The TAB and IPOM was the most popular techniques for them to do. And the cost, around 1,000 US dollar, which is also a very high cost in this country. And actually where the open hernia surgery really takes maybe 1/4 or 1/3 of the whole cost, what we do when we do by laparoscopy. In July 2022, I mean, just a few months ago, we really started or tried to do another study. And we found that as out of 70%, both laparoscopic and open surgery are being done more than 50% surgeons. That was a very encouraging finding for us that they have started doing this. And you can see around 50% were doing, well, in case of ventral hernia, IPOM and IPOM plus was the technique. And actually, if you talk about interest, they are really growing a huge interest in anterior or posterior component separation. And these are the things our surgeons are thinking to do and how they want to do. We have asked them what groin repair techniques they're interested in. We have found, again, the TAB and TEP are the most popular techniques, and still some are doing some open surgery, but trying both. And what kind of academic programs we have asked them they want to have and work best for your development in hernia management. You can see everybody wants to assist a trainer or mentor, and direct assisting a experienced surgeon in hernia surgery was their idea to go for, to have more confidence in doing this surgery. And of course, there was no, we also know that there is no alternative in learning without having an experience working with an expert surgeon. Of course, cadaver and animal models are not very popular in this country, but still some are interested to go out for this kind of training. And we have also asked them what kind of academic programs they would prefer to be, offered by the Hernia Society of Bangladesh. And most of them, again, hands-on training and masterclass hands-on training was their priority. And hernia essential advanced programs also they asked for, because we have done some basics with the help of Anil Sharma, Rajesh Khullar, Dipraj Bandekar came many times to Bangladesh, and we have done some basic programs, but they are still looking for some advanced training. Now, after all this study, rather I should say surveys, we could find that the obstacles remains with the surgeons, with the patient, and overall the environment for a surgeon and the patient to do and undergo this kind of procedures. And with the surgeons, it was clear that lack of training, lack of referral system, and some personal bias were the factors, and adequate patient counseling was not very confidently done by the surgeons, because they are also confused by themselves, and that's why they couldn't counsel the patient as well. And from the patient perspective, high cost was a very important factor. In a country like Bangladesh, still no insurance coverage, and patient demands for laparoscopic procedure was not as high as LapCon, because it was, I said in the beginning that laparoscopic surgery was really came forward and got popularity by the demand of patient. But in hernia cases, the patient also didn't know about it very well. And of course, stigma and misinformation were important. And overall hospital environment, operation theater environment instruments. These are all very important factors to consider. And if we think about anesthesia support also, we should not really keep that aside because it's a country of hugely populated country. Patients, bulk is huge, and our anesthetists really don't want to give much time for a learning curve when they take hours for doing a hernia surgery by laparoscopy. Now, how we really want to overcome or what we need to overcome. Actually, we need passion and need and changes in perspective and ideas and improvement of means and tools. Though these are very wide terms, but we should address these things because these are important. And we know teaching is a best way of learning also. If you want to master something, teach it. And I really emphasize that teachers who are already experts, they should go for some kind of teaching, and that will improve them, that will, individual surgeon can develop them, and mentorship by experienced surgeon for the beginners is very, very important. And that's how the first model was a very important model. And you see how a novice and advanced beginner and the competent surgeon proficients develop their proficiency and become an expert. And that's how we learn, do, and teach. Overcoming the obstacles again, the patient's perception. If we think about the creating and improving public awareness is important, adequate counseling is important, which should be done by the doctor and practicing doctor. And motivation during practice is also important. And providing cost benefits, how we can reduce the cost should be a very important factor in overcoming these obstacles, what we have found in our surveys. Environmental changes, we all know about it. Organizational support is very important because providing the proper mesh, equipment, instruments, and with low cost support is important, and the cost reduction, hospital charges, reduction of tax and cost of mesh and other minimal access surgery equipment, and Hernia and Surgical Society provided course and training and objective assessment and tailored support by the Hernia Society, develop and promote international partnership like countries like India. Our friends are eager to teach us and they want to come and do help us, but definitely we'll have to exercise that practice and improve patient accessibility and develop training centers and skill lab. What last time Anil Sharma, Deepraj, and Rajesh, they all put emphasis on, the skill labs are very important to develop for training to the younger generation surgeon for hernia. So we were trying our best to do these things. You can see the Society of Surgeons were formed in '79, but Hernia Society was formed in 2017, just the other day. So, but actually we should have done it before, and we should have put more emphasis on hernia surgery, and which is a very, very important part of our surgical practice. And Hernia Society, though was formed in '17, we have been doing some very important work, like it has become the country chapter of APHS and runs hernia essential courses and 3-day masterclass hands-on course. Also, we did some in Bangladesh and live workshop and working with online national registry. And we are thinking to involve everybody, every surgeons in general surgeons who are doing hernia to go for laparoscopic procedure. And endeavors, we have put masterclass, hernia essentials, live workshop, etc. And we also get feedback from them to improve ourselves, how we can improve the society activities in a more efficient way. And we really asked during our survey in last July, please write any constructive comments that you may have regarding mass hernia surgery or from the Society of Hernia Society of Bangladesh. And everybody said hands-on training is the key. And of course, proper guideline, academic calendar, we should make to go for this specialized hernia training center was everybody's demand. And actually, junior surgeons want to perform this hernia surgery in presence of expert surgeon. That's another point. But at the moment, we are really lacking experts in number. If we compare, the junior surgeons number is huge. They are interested, but we don't have much expert surgeons to teach them. But we should look into the matter. And in that case, definitely our friends can help us. And definitely we shouldn't forget about robotics. Robot is knocking at the door. Everybody's talking about it. And we should think, of course, it's getting cheaper and excellent ground. There is in India. India is doing great in robots. And really, our people's purchasing power is also rising. So robot will be a very important factor in future. So I'm almost at the end, and the technology developments are making our lives very easy. We need we need to work together. HSB, Hernia Society of Bangladesh, Hernia Society of India, and definitely with that collaboration, we will go for developing this thing.